Our first case study highlights Maria, who is a 45-year-old Hispanic female who has had type 2 diabetes for 15 years and is treated with metformin, 1,000 milligrams BID, and glipizide, 20 milligrams BID. She has gained 10 pounds and is having difficulty losing it. The patient reports not remembering when she had her last foot exam, which is recommended to be done annually. Her last eye exam was 6 months ago, so she's up to date on the recommended annual eye exam. She is taking lisinopril 10 milligrams for her blood pressure management and atorvastatin 40 milligrams for her cholesterol management. Her A1C ranged from 7.5 to 9% in the past 2 to 3 years. She reports a weight gain of 10 pounds, frustrated with the inability to lose weight despite diet and exercise. She does not smoke. Let's watch as Dr. Bassina meets with Maria.
Good morning, Maria. I am so pleased you're here in the clinic today. I would like first to just find out what's the goal for our visit today. What would you like to achieve today, during today's visit?
Let's see, recently I've been trying to lose 10 pounds that I gained a while back, but despite eating better and getting exercise, I just can't seem to lose it. And I've just been feeling really frustrated and worried that it might be tied to my diabetes or maybe my medication.
I can totally understand your frustrations, and I'm glad that weight loss is a great goal. But before we talk about the medications and the diabetes control, let me try to get some more information about your past medical history, about the family history, and past medications that you've used for diabetes treatment.
We see from the patient's medical record that at diagnosis, her A1C was 8.9%. And after 3 months of the initial metformin treatment, her A1C dropped to 8%, which was still elevated. At this point, glipizide 5 milligrams BID was added to her regimen. The dose was gradually titrated to 20 milligrams BID. Her A1C dropped to 7.1%. However, as her blood sugar improved, she started having symptoms of feeling shaky, foggy, and sweaty. Her blood sugars were in the low range at the time of these symptoms. She reported that she began to compensate with frequent snacks, which likely contributed to weight gain and a subsequent rise in A1C. Her dietary choices at the time of hypoglycemia were culturally embedded, consisting of foods she had been eating her whole life. She was unaware that these foods were a contributing factor to her unsuccessfully managed diabetes and weight fluctuations. This brings us to today, as she continues to struggle with that weight gain and is presented with an A1C above 8.2% for over the past year. Maria's diabetes therapy needs to be adjusted, but first, Dr. Bassina needs to learn more about Maria's lifestyle and diet.
Thank you for sharing this information with me. This is really helpful for me to know. I can see that you had a blood work done about a month ago and your hemoglobin A1C was elevated. It was 8.3%. Can you tell me a little bit more about which medicines are you taking now and how often and what the doses are?
Yeah, so I still am taking metformin. I take 1,000 milligrams at breakfast and at dinner when I remember. Sometimes I've got to dinner and I just don't have my pills on me. I stopped taking the glipizide because I noticed that it was making my blood sugars low. And sometimes even when I'm watching my diet and trying to exercise more, that I'm still feeling shaky and low. Well, recently I went on vacation and I tested my blood sugars and I was up to 372, so I got scared. But, I think that's because I was eating really unhealthy. I was eating chips and sweets and rice, and those aren't things that I have so often at home. I don't know, it just feels like it's so hard to keep my blood sugars in range, not too high, not too low. I mean, sometimes I miss my medications, but, I've noticed when I miss my glipizide, I get high, into the 200s and above. But then conversely, when I take my glipizide, I feel like I'm so hungry, I could eat a whole cow.
Wow. So So what is your usual schedule at home for the meals? Do you eat more like small meals throughout the day, more like a grazing type of the food intake, or you're eating your regular meals and you don't snack during the day? And do you normally snack at bedtime? Because the reason I'm asking and I want to get all this information is that when we come up with the medication schedule, I want to make sure it fits your schedule and your needs so you can be easier for your lifestyle.
Okay, yeah. So usually I have breakfast like on the way to work or when I get there. Sometimes I have lunch if I have enough time. But honestly, I think my largest meal is at night. And yeah, I do snack at night. And that's usually because, it's usually when I'm feeling relaxed that I realize like how hungry I am.
Thank you for sharing this information with me. This is really helpful. And I understand it's difficult to make adjustments in your schedule. And everyone is, as we human beings, it's difficult and we all tend to do that. But what we would try to do is to try to reduce your cravings at night, because consuming those higher calorie and high carb snacks at night make your blood sugars go up. Also, when you're not moving after eating those snacks, that causes the weight gain, and blood sugars stay up overnight and then continue being elevated in the morning. But we really want to work with you to try to make it easier for you and to find the medication regimen that would best fit your schedule.
Let's review what we've learned so far. Maria is on a dual therapy regimen of metformin and glipizide, which is a sulfonylurea. Her A1C has improved somewhat, but it's clear glipizide isn't working for Maria. In addition to her difficulty adhering to the daily medication, it's affecting her ability to control her diet. Before we add an additional agent to Maria's therapy, we need to see if adjustments can be made, such as replacing glipizide with another agent and referring Maria to a dietitian who can help her come up with alternative foods to eat and a better lifestyle management plan. Looking at options for different therapeutic agents, a GLP-1 receptor such as dulaglutide is a suitable alternative to glipizide. It is a once-weekly injectable medication that does not cause hypoglycemia, promotes weight loss, and provides an improvement in glycemic control. However, Maria has expressed a fear of needles and prefers to avoid taking injections. Many patients have a fear of taking insulin injections, so it is important to explain that a GLP-1 agonist is unlike a daily insulin injection. The benefit of the medication outweighs the inconvenience of the injection, but broaching this topic requires sensitivity and a reassuring approach. Let's see how Dr. Bassina outlines all the benefits to the patient in order for her to overcome her fear of the injections.
Based on the information that you shared with me today, I think that the best treatment option would be to start you on the injections, which I totally understand, and I know you previously expressed to me that your concerns and fear with the injections, but let me just explain you first. So this is the medicine that you would take only once a week, and the needle is small, and the injection is really not causing much of the discomfort. And most of the time, patients would say that checking the blood sugar is way more uncomfortable than taking the shot. The needle is small, and the medicine is really most of the time very well tolerated. We would just need to check with your insurance to make sure that the medicine is covered. But I would also like to ask you to check your blood sugars a couple times a day, and maybe before breakfast, before dinner, so I will get a little more information about your blood sugar readings throughout the day, which will help me to make further adjustment if needed in your medication.
Okay. Well, I feel a little bit uncomfortable because I'm so scared of needles. Where would I have to do the injections, and are there side effects to the medication?
Yeah, so we will definitely give you a lot of information about the medicine. I will have the nurse come and show you how to administer injections. If you want to try it, you can try it in the clinic. We have training pans and you would be able to do it yourself. If you have any concerns or if you feel that it's too complicated, we can always do it again and have another session with the nurse, another teaching session. So the medication can be administered either in the stomach or the thigh or the arm. And again, it's a very easy medicine. It's just once a week. And the medication provides a lot of benefits, which are help. One of the advantages is to help you with the blood sugar control, reduce your craving, help with the weight loss, help to achieve your goal in hemoglobin A1C. And there are some side effects from the medicine. One is a little bit uncomfortable with the injection, like any injection. But again, as we say before, that the needle is really small and it's really easy to give. The medicine also can cause a little bit of the stomach upset and some nausea. And that's only in the beginning, and it usually goes away. And if there is something that doesn't work for you with this medication, we can always change it or come up with a different regimen.
Okay, I can do that. I mean, if it's only once a week and the needle's small, I can give it a try. But someone's going to show me how to do it, right?
Absolutely. I will have the nurse come into the room and show you, demonstrate you how to take those injections, and you will try it yourself. To make sure that you remember after you leave the clinic, we will provide you with a link that you would be able to watch the video as your sort of reminder how to take those injections. Also, I would suggest and would like you to schedule an appointment with my dietitian, and she can go over different food choices and snack choices that will make you feel not hungry throughout the day, but choose sort of the healthier food and snacks for your meals and some snacks during the day and night.
The patient presents back in 3 months after seeing the registered dietitian and certified diabetes educator and starting the GLP-1. She has lost 9 pounds and her A1C is 6.8. She states that she did not realize her previous diet, including eating out for lunch and some dinners, was so high in calories and carbohydrates. She's made changes to her meal plan, including making healthier choices when eating out, packing her lunch 2 to 3 times per week, and using a phone app to track her food intake. Let's see how Maria's check-in with Dr. Bessina is going.
Good morning, Maria. I am so glad to see you today and give you good news that I have your blood test for hemoglobin A1C, and the level came down to 6.8%, which is great success. I also saw that you were able to lose 9 pounds, which is wonderful. So you did a great job. Tell me, what do you think helped you the most to succeed? And what do you think about those injections? Because I remember in the beginning you had lots of concerns about taking shots of dulaglutide. What do you think about those now?
Well, first of all, thank you, Dr. Bessina, for all your help. I was pretty nervous about the needles at first, but then since they were kind of small, I realized over time that it got easier. I think the thing that was the most helpful was the dietitian, like you recommended, was just working with her to realize like how many calories I was eating that my body didn't need, and figuring out that I was just going to like a lot of carbohydrates, because a lot of the foods that are my sort of go-to foods are really high in carbs. So with that support, I was able to figure out how to start eating better.
Sure, and in this you're not alone. This is very common, and I hear this all the time.
But now I've learned that I can still eat the foods that I'm used to. Mm-hmm. I just need to find lighter, lower carb ways to enjoy them or to prepare them. And I'm also not going out as much to eat, which has been good for my diabetes and my wallet. And I'm trying to just stay stocked up on lower carb, lower calorie options that are good for me and delicious. I've started to make changes. Like I am now eating cauliflower rice seasoned with cilantro and garlic, and it's delicious. I've also started using grilled red bell peppers for my tacos. I guess I just never realized that I could fill up on vegetables, and they're actually delicious.
Excellent. I'm so glad to hear that you found foods and choices that work for you.
Oh, and I've also been using this new phone app that helps me track my calories and my food intake. So I feel like with that and all the different food choices that I've been making and making better choices, that I just feel like I'm eating healthier and doing better altogether.
Thank you for your such a hard and great job that you did, and I'm very happy with the success. To make sure that we are sustainable with our achievements, I would like to order some quarterly hemoglobin A1C levels. We would also monitor your kidney function, electrolytes. We would be periodically checking your lipid panel, which will be a fasting test. And also once a year, we will check the little urine sample to make sure that the kidneys are working well and not spilling some protein as an effect of diabetes.
For now, Dr. Bassina and Maria have found a dual therapy that combines diet and medications that work for her. They will continue to monitor her levels, including A1C every 3 to 6 months. This concludes Case 1. When you are ready, please advance to Case 2, Marcus, in the course menu.